Let's get more now on the easing of COVID restrictions. And as the government lifts the rules on travel and people begin to book holidays, there are growing concerns about the spread of the Indian variant and whether it's truly safe to allow travel into and out of the UK. Let's speak to Bharat Pankania, who's a senior clinical lecturer at the University of Exeter. Bharat Pankania, thanks very much indeed for being with us. We heard from the Prime Minister Boris Johnson in the last couple of hours, speaking at Prime Minister's questions. And he struck a more optimistic, more upbeat tone than he has in recent days, suggesting that the vaccines are working. Can we see that yet?
So thus far, the vaccines are doing an exceptionally good job, but that doesn't mean that the vaccines are the magic bullet. What we need to do with respect to a more infectious variant from India and other parts of the world is to immunize and immunize at pace, both locally and internationally.
Vaccines, though, are they not a relatively blunt instrument when you've already got an outbreak? So, for example, when we're seeing the surge vaccinations taking place in places like Bolton, is that enough? Or does more need to be done to try and stamp this out?
Oh, no, a lot more needs to be done. It is, as you say, a blunt instrument, but a good instrument. So, for example, wherever you have these flash points, what we need to do is test, identify, and remove from circulation. But we need to bear in mind that not everyone can sit at home and work on the internet. They need support to remain at home, and that means financial support, and also advice and information about the importance of staying out of circulation. So those are control measures. And then on top of that, you go in there and blitz the place and give as many vaccines as you can to all the people. You don't coerce them, but you give the vaccine to all age groups.
How do you encourage more people to come forward and have the vaccine? There's a lot of discussion about it's all very well saying go online and book your vaccine. That's not that easy for everybody. How do you take the vaccine to those communities where the uptake so far might not have been as high as it should be?
Yes, a very important issue. So it has to be multifaceted. I'm reminded of when I was a consultant communicable disease control in Bristol, and we had a low uptake of the MMR vaccine. What I did was go to the community, talk to them and address their fears, give them the advice, show them the benefits of being immunized compared to the no risk of being immunized by the vaccine. Therefore, you then take your people with you. And then the other multifaceted approach also is make it available where they are. So instead of asking them to take a long taxi ride or a long drive to the vaccination center, you can have mobile clinics come to those areas to offer the vaccines and cover that area at pace. Number of multifaceted approaches required.
The prevalence of the Indian variant, the arrival and then the spread of it in this country has led to more scrutiny of our border controls. The government argues that although India wasn't on the red list for some time, it was on the amber list, and so therefore arrivals should have been having to go into quarantine for 10 days and test. Does that suggest that that amber list isn't working? If it was working, would we be seeing what we are now?
I hesitate to answer because the answer is obvious. It doesn't work. We know that it hasn't worked for a long time, and we are tinkering at the edges. If you really want to control it, then you adopt the Australia-New Zealand model. Everything else is tinkering, and we both know that. And unfortunately, we are sold this pup of you have a PCR test at day 1, and then you can have one at day 5, and if you're negative, out you come. And we know that on day 7, 8, 9, 10, so on, you can still become infected. Therefore, my answer is yes, we're tinkering at the edges. We're not taking it seriously.
I guess I probably know then from that answer what you're going to say to my next question. But on travel, much confusion over the past couple of days of what we can and can't do. The Government Minister Gillian Keegan this morning saying people should make their own minds up. It's about common sense. Lord Bethell yesterday saying people should stay in this country. All travel abroad this year is dangerous. Where do you stand on that?
I think it is better to stay in the home country for several reasons. You are entering a unknown, unexpected issue when you go abroad. It is not a simple case of you're going from one place to another place and you will be safe. In between, there is transport and mixing with other passengers from other parts of the world. And also, you don't know what the healthcare system is in that country. Therefore, for many reasons, it is better to be cautious and precautionary and take those travel arrangements very carefully. Ideally, stay put in the UK.
What then do you make, Bharat Pankhania, of the EU approach that fully vaccinated visitors should be able to arrive, should be able to travel to EU countries without having to quarantine because they are adequately protected?
So they are as well protected as can be. And that is not a bad idea. And to think about it, the United States Centers for Disease Control has said that people who are fully immunized can interact with each other. And the EU is taking the same approach. Now, what I would say is not a bad idea, but be cautious and be careful and be aware. Be aware that even though you have been fully immunized, it doesn't mean in 100% of the cases you are immune. So there will be a proportion of people, depending on your age and other things, about 10–15%, who never mount an immune response. But we are where we are. So what would I say is, if you are fully immunized, you are in the best possible place, but that doesn't mean you drop your guard altogether.
Bharat Pankhania, good to see you as always. Thank you.
Thank you.